Attention, healthcare professionals, human resource managers, and educators. Get their attention. Maintain their retention. Discover the secret to the retaining quality nurses and increasing your quality of care, bolstering your employee relations, and boosting your value to patients. Hey, can you spare a minute? If so, I'd like to tell you a story. Meet Mose. Mose is a healthcare professional and has worked in healthcare since he's entered the workforce. In fact, he's always been involved in some aspect of the medical field, even volunteering in high school. To Mose, there's no greater calling than to see those with ailments on the road to recovery and wellness. His life was pretty much like everyone else's, until one fateful day. You see, Mose realized that he had a problem with retaining a trained nursing staff. He loved the hospital that he worked for and wanted to enhance and optimize organizational effectiveness. However, current nursing shortages put the kibosh at just running a ward at minimal staffing levels. He understood some of the reasons why. Fewer nursing graduates in the US, and of others he realized he may not even be aware. Unfortunately, Mose stuck his head in the sand, so to speak. Deep down, he didn't believe he could succeed in his new management position. Sometimes he felt as if he just wanted to get back in the trenches and do the job himself. And sometimes, because of staffing levels, sick days, and so forth, he had to do it anyway. Everywhere he looked, Mose saw nothing but problems, all working against him. Lack of students entering nursing school and the profession, deficient retention of nurses due to job burnout, insufficient pay, promotion, and work-life balance. The biggest hurdle Mose had to overcome was understanding what the current generation wanted from his organization. And even if he knew what it was they wanted, how to fulfill those desires to retain a nursing staff. To Mose, it meant this obstacle really hurt the healthcare industry because it affected the bottom line. A nursing shortage means patients are getting Band-Aid solutions to bullet hole problems. If you're only as strong as your weakest link, it means quality care is out the window. Dissatisfied patients meant that they would go elsewhere. Undesirable word-of-mouth marketing creates a customer service nightmare. And this hurdle is such a huge deal, research has revealed retention helps with patient safety and care. To make things even worse, many healthcare professionals, regardless of job profile, nurses, nurse managers, educators, or human resource professionals, believe all cohorts from generation to generation have the same work preferences and career desires in the nursing profession. However, research has revealed this is not the case. Mose also believed this to be true. Mose was desperate, but didn't really have a clue where to begin. Things looked helpless for Mose. Then one day, Mose went to lunch with his friend, June, a longtime friend who was in town for the day. June noticed Mose wasn't the upbeat guy that she had known for years. She asked Mose why he looked so down, and after a little coaxing, Mose spilled the beans. He poured his heart to June about his situation, his frustrations, and his disappointments. When he finished, June laughed good-naturedly, which surprised Mo a little. Perhaps it was because she worked in Los Angeles and had access to a much larger staff, and Mose told her so. June continued to smile, and finally, after a long pause, she uttered 3 little words: the nurse commitment. What? Mose was puzzled. You need to talk to Dr. April Jones, June told him. June went on to tell Mose all about her secret weapon, the nurse commitment, how to retain nurses in a multi-generational workforce by Dr. April Jones. Though June had access to a huge nursing staff at the hospital in the City of Angels, Dr. April Jones delivered results. Once June explained everything, Mose couldn't wait to get started. And after he purchased the book, it was, well, like magic. In the nurse commitment, Mose discovered how to distinguish the various work preferences of each generational cohort and how to intertwine these different preferences into the workplace to develop diverse organization employee development plans for each nurse's unique desires. Mose also discovered how to attain new information to enhance his understanding of generational cohort differences with work preferences and get the tools he needed to help with a formal employee development plan that will work. Enhance staff morale. Nurses since were afforded opportunities to develop themselves based on their generational cohort work preferences. Foster respect for generational cohort differences and work preferences in the workplace, letting nurses know it's okay to be. It's okay to have those desires, and it's okay to think outside the box. Value diversity among cohorts in a multi-generational workforce. Lead more effectively and manage his staff more efficiently by having a formal process in place. Apply these principles to any industry, prompting ideas for opportunities to help others who may be suffering from the same difficulties he had faced. So, as you can see, this story has a happy ending for Mose and organization. With Nurse Commitment, How to Retain Nurses in a Multi-Generational Workforce, he found just the right tools and advice, and more importantly, he put them to good use. And best of all, Mose was able to start seeing results in just about an hour from the time he started reading the book, and it cost just a few dollars. So, if you're a healthcare professional, be it a nurse, nurse manager, educator, human resource professional, and you want to be like Mose, understand the unit. Understanding generational differences in the workplace is essential. Nurses are the backbone of the nursing profession and are necessary to ensure patients receive the best quality of care. Implementing a proven professional growth portfolio for staff retention and organizational effectiveness is paramount. Today is the best time to target your team to retain talented nurses because the shortages exist and all real threat, and the staffing trends aren't improving without action. Get Nurse Commitment right now. Grab your copy of Nurse Commitment, How to Retain Nurses in a Multi-Generational Workforce now, and let Visionary Consulting Services, LLC, help you obtain current information to skyrocket your understanding of generational cohort differences with work preferences and get a proven, formal employee development plan, just like Mose.